Okay, guys, today we are going to discuss other methods of birth control. So, in the last lecture, we were discussing mechanical methods. As I told you earlier, these mechanical methods of birth control, they involve the use of condoms, they involve the use of IUDs, they involve the use of cervical caps and diaphragms, right? So, first we will have a look what are these condoms. These condoms, they are rubber or they are rubber or latex cappings. They are rubber or latex cappings, which are used by both male and female. So they are of two types: male condoms, male condoms, and female condoms, and female condoms. This female condom it is also known as femidome. It is also known as femidome, right? So these male condoms they are basically folded rubber caps having an open ring. It is the open ring and it is just folded with a pointed tip with a pointed tip. So they come in a pack like this, folded like this. This is their upper ring. This ring is folded, and this rubber capping it is to be put onto the pins by the male, right? So this is first this this ring, this folded rubber capping. It is to be put onto the pins. Suppose this is the pins. If it is the pins of the male, it is to be put onto the pins. It is to be put onto the pins, right? Then this rubber ring, it is rolled backwards. It is rolled backwards. When it is rolled backwards, it covers the whole pins like this. It covers the whole pins like this. So we need to roll this backwards, this ring. So when the ring is rolled backwards, it covers the whole pins up to the base of the pins. So when the male ejaculates during the sexual intercourse, the semen gets deposited in its tip. A male has to insert his penis into the vagina of the female along with this condom. So when the male is going for now intercourse, male reaches to orgasm and at orgasm male ejaculates. This ejaculate accumulates into the tip of this condom. It accumulates in the tip of the condom. Then as the sexual intercourse is over, when the sexual activity is over, male withdraws the penis from the vagina of the female and then male takes off this rubber condom and it is discarded along with the semen. So when the male ejaculates the semen, that semen accumulates in this rubber cap, in this rubber condom, and the male withdraws the penis along with the condom from the vagina of the female, and all the semen is in this condom, and then male discards this condom along with the semen, so the female is not inseminated, right? So this is the male condom. Similarly, there are female condoms. Similarly, there are female condoms. Let's have a look at the female condom. A female condom is again a rubber capping, which has got two rings. One is open ring and its another ring is closed. It has got two folded rings. This is the open ring, open ring, and this is the closed ring. This is the closed ring. So a female has to insert this femidome into her vagina. It is to be inserted. it is to be inserted into vagina. Into vagina. So how does a female insert this into her vagina? So female inserts this into her vagina by the help of her finger, right? So if it is the vagina, if this is the vulva, in the vulva there is vaginal orifice, there is urethral orifice, then there is the vaginal canal, then there is the cervix, then there is the uterus, right? So female has to insert it by the help of her fingers into the vaginal canal, and it is open end, should cover the vaginal orifice. It should cover the vulva. It is open and should cover the vaginal orifice or the vulva, right? So at the time of sexual intercourse, a male has to insert his penis into this femidome. The male has to insert his penis into the femidome so that when the male ejaculates, the semen should get deposited in this extended femidome. Its lower end is closed. The male has inserted his penis into it. Right? Now, as the male ejaculates, the semen accumulates in this femidome. And when the sexual intercourse is over, male takes out his penis from this femidome, and the female pulls this femidome out. Along with the semen. So its underlying mechanism is same as the male condom. So it collects the semen. When the male ejaculates, he ejaculates the semen into this femidome. Now, when the sexual activity is over, male withdraws the penis. Then female pulls this femidome out of her vagina along with the semen. Then this is discarded along with the semen. So, in both the cases, insemination of the female is prevented. So, when there is no deposition of semen in the vagina of the female, then there is no chance of fertilization, right? So, these condoms, they are rubber cappings or latex cappings, which are used by male as well as female. They are both used for preventing insemination. In case of male condom, a male puts on the condom onto his penis and then inserts the penis along with the condom into the vagina of the female. As the male goes for sexual intercourse, male ejaculates, that ejaculate accumulates into the condom. When the sexual activity is over, male takes out the penis along with the condom from the vagina of the female, then takes off this condom along with the semen from his penis and discards it, so that no semen is deposited in the vagina of female. Similarly, in case of femidome, a female inserts this femidome into her vagina by the help of her fingers. So it has got one open end and one closed end. So when the male inserts penis into the vagina of the female, male has to ensure that his penis is inside the femidome. So when the male goes for sexual intercourse, he ejaculates, he discharges the semen. The semen must collect inside the femidome, right? Once the sexual intercourse is over, then the male withdraws the penis from the femidome, from the vagina of the female. Then female pulls this femidome out along with the semen, so that there is no deposition of semen in the vagina. So when no semen is deposited, there is no chance of fertilization. So these are known as condoms, equally used by males and females. So their underlying mechanism is to prevent insemination. Then after this, we have got IUDs. There are IUDs. These IUDs, they also act as contraceptive devices. So how an IUD acts as a contraceptive device? So IUDs, these are metal or plastic devices. Which are put they are put the uterus into the uterus of the female by a registered medical practitioner. medical practitioner. So female cannot use it by herself. They are to be implanted into the uterus of the female by the help of a registered medical practitioner, right? So these IUDs are metal or plastic devices. They are put into the uterus of the female by the help of a registered medical practitioner, right? So how do they prevent how do they prevent conception? How do they prevent pregnancy? So when these IUDs are inside the uterus, when they are inside the uterus, they irritate, they irritate the uterine endometrium. Uterine endometrium. They irritate uterine endometrium. And this irritated uterine endometrium, it releases leukocytes. It releases leukocytes. Leukocytes are a type of white blood. They are also known as white blood corpuscles. White blood corpuscles. Most of them are phagocytic. Most of them are phagocytic in action, right? So these leukocytes, these white blood corpuscles, which are phagocytic in action, they eat up, they eat up the sperm. They kill the sperms by eating them, right? So the underlying mechanism of an IUD is that its presence inside the uterus irritates the uterine endometrium, which in response releases leukocytes, white blood corpuscles, mainly phagocytic cells. Those phagocytic cells, they eat up the sperms. Some of these metal IUDs, they also release copper ions. Some of these metal IUDs release copper ions. For example, you may have heard about copper T. Copper T is an IUD, right? This copper T, it releases copper ions. It releases copper ions. And these copper ions, they are spermicidal. They are spermicidal in action. They kill the sperms. They kill the sperms, right? They are poisonous for the sperms. They are poisonous for sperms. They kill the sperms. So when we use a copper T, first its presence will stimulate uterine endometrium to release phagocytes. Those phagocytes will eat up the sperm. Then it also simultaneously releases copper ions. These copper ions, they prove toxic. They prove toxic to sperms. And they also further kill the sperms. They also further kill the sperm. Similarly, some plastic IUDs. We also use some plastic IUDs. These plastic IUDs, they are loaded with hormones, synthetic hormones. They are loaded with synthetic hormones. For example, they are loaded with levonorgestrel. Levonorgestrel hormone. This copper IUD, it also causes uterine endometrium to release prostaglandins. Prostaglandins. Copper IUD also causes uterine endometrium to release prostaglandins. These prostaglandins, they initiate strong contractions of the uterine uterus. They initiate strong contractions in the uterine endometrium, particularly in the myometrium. You know, myometrium is the wall of uterus which contains muscles in it. These prostaglandins, they stimulate the muscles of the uterus to undergo strong, vigorous contractions. So that doesn't allow the blastocyst to get implanted. So copper T, first its presence in the uterus causes the release of leukocytes. Leukocytes eat up the sperm. Then copper ions, they prove toxic to the sperms. They kill the sperms by their toxicity. Number third, they also cause release of prostaglandins. So these prostaglandins, they induce strong contractions in the uterus. These strong contractions of the uterus, they do not allow the blastocyst to get implanted. So in this way, they prevent pregnancy, right? We can use a copper T as an emergency contraceptive device. We can use a copper T as an emergency contraceptive device up to 5 days of unprotected sexual intercourse or a condom failure. Copper T can be used as an emergency contraceptive device in case of an unprotected sexual intercourse or in case of contraceptive failure or in case of a contraceptive failure. So it should be used within 5 days, right? So it will irritate the uterine endometrium, that will release leukocytes, and leukocyte may kill the sperm. It will release copper ions, their toxicity kills the sperms, and it will release prostaglandins. Those prostaglandins will not allow. These prostaglandins does not allow the implantation of a blastocyst. So thereby they act as contraceptive device, right? So that is about IUDs. So IUD can be a metal device or it can be a plastic device. So plastic devices, they are loaded with synthetic hormonal preparations which act as contraceptives. Well as copper T, it causes a release of leukocytes. It also causes this release of copper ions which prove toxic to sperms, and it also causes release of prostaglandins which does not allow a blastocyst to get implanted. So they serve as contraceptive device. In this diagram, you can see how a copper T is inserted into the uterus. It is somewhat T-shaped. This is actually a synthetic IUD having hormones in it. Then there we have got another diagram. You can see this is the diagram of copper T. It is a T-shaped device. And you can see it is having copper attached to it. So this copper, it releases the copper ions, and those copper ions, they prove toxic to the sperms, right? So okay, so this is how they act as contraceptive devices. Now we have got cervical caps and the diaphragm. This is the cervix, this is the cervical canal, then this is the vagina, and then this is the uterus. Sorry, this is the vulva. So cervical caps or diaphragms, they are again rubber. They are made of rubber. They are dome-shaped rubber caps. These are dome-shaped rubber caps, which are put onto the os externa. They cover the os externa of cervical canal. They cover the os externa of cervical canal. So they block the cervical canal. These dome-shaped rubber caps, known as cervical caps or diaphragms, they block the cervical canal, right? So they are dome-shaped structures. They fit onto the os externa of the cervical canal, and they block it so that sperms cannot enter into the uterus. They are also smeared with. These are also smeared with spermicidal chemicals. So when a male inseminates a female, when the semen is deposited in the vagina of the female, this is the vagina. When the semen is deposited in the vagina of the female, right? The sperms, when they come in contact with these cervical caps or diaphragms, they are having spermicidal chemicals. Those spermicidal chemicals, they kill the sperm, and they also do not allow the sperm to enter into the uterus. So when there is no sperm entering into the uterus, then there is no chance of fertilization, right? So they act as contraceptive devices by blocking the movement of sperms from vagina into the uterus. They kill the sperms by their spermicidal chemicals in the vagina, and they do not allow the sperms to cross over the cervical canal into uterus. So they do not allow the sperms to reach to the womb. So they act as contraceptive devices. They act as contraceptive devices. So that is all about the mechanical devices or mechanical. Now, after mechanical method, we are going to discuss about physiological method. Physiological methods of birth control. So these physiological methods of birth control, they involve the use of contraceptive oral contraceptive pills. They involve the use of hormonal implants, hormonal implants, or they involve the use of injectable, injectable contraceptives, contraceptives. So in physiological contraceptive methods, we are going to discuss about the use of oral contraceptive pills, hormonal implants, and injectable contraceptives. So first we will have a look at the oral contraceptive pills. These oral contraceptive pills, they are the tablets which are taken by the female through her mouth. That is why we call them as oral contraceptive pills, right? These oral contraceptive pills, there are two types. There are two types. One is known as combined oral contraceptive pills, and another is known as progestin only. Progestin only pills, or we also call them as mini pills. So there are two types of oral contraceptive pills: combined oral contraceptive pills and progestin only pills, which are also known as mini pills. So what are these combined oral contraceptive pills? These are the pills or tablets. They are the pills or tablets which have both synthetic progestin, progestins and estrogens in them. So they are having the combination of both progestins and estrogens, which are synthetic, right? That is why we call them as combined, because they involve the combination of synthetic progestins and estrogens. That is why they are known as combined oral contraceptive pills. Now there are two types. One is known as Maladi and another is known as Sahini. As the name indicates, Maladi. Mala means in the form of a series. So this Maladi, it is to be taken daily. D stands for daily. Mala stands for a series. So it is taken in the form of a series and it is taken to be daily. Mala D. Right? So it is taken from day 5th to day 25th of menstrual cycle, reproductive cycle. So that means this tablet is taken, it is to be taken for 21 days. One tablet per day. One tablet per day. So it is taken in the form of a series. That is why we call it as mala, because this tablet is to be taken by a female in a continuous series for 21 days. For 21 days. When she has to start the intake of this tablet, This tablet is to be taken on the fifth day of the menstrual cycle. When the menstrual phase is over, now starts the luteal. Sorry, now starts the proliferative phase. So on the first day of the proliferative phase, that is on the fifth day, after 25th day of the menstrual cycle, this tablet is to be taken. So that means it is to be taken for 21 days. If a female forgets to take a tablet at the scheduled time, she should take the tablet whenever she remembers that she had forgotten to take the tablet. If a female even forgets, forgets to take a tablet on a particular day, then she must take it on the subsequent day. And on the subsequent day, she must take two tablets together, right? So this series should not be broken. How do they act as contraceptive? These progesterone and estrogens, they lower, they lower, or we can say they inhibit secretion of follicle stimulating hormone and luteinizing hormone. We know the role of follicle stimulating hormone is to convert a primary ovarian follicle into a graafian follicle. Or we may say this follicle stimulating hormone, it is involved in the formation of the ovum. From a primary ovarian follicle, it changes it into a graafian follicle. So a primary oocyte is converted into a secondary oocyte by this follicle stimulating hormone. Then luteinizing hormone, it is involved in the release of ovum. It causes the mature graafian follicle to burst open and release the secondary oocyte, right? So these synthetic progesterones and estrogens, they inhibit the secretion of follicle stimulating hormone and luteinizing hormone. So thereby preventing the formation and release of the ovum. So when ovum is not formed, when the ovum is not released, then there is no chance of fertilization, right? So this is malady. So it acts as a contraceptive and it needs to be taken daily for 21 days, starting from the fifth day of the menstrual cycle up to the 25th day of the menstrual cycle. If a female forgets to take a tablet, whenever she remembers that she had forgotten to take a tablet, she should immediately take the tablet. Even if she skips a day, then on the next day, she should take two tablets together so that the levels of progesterone and estrogens are maintained in blood so that follicle stimulating hormone and luteinizing hormone secretion is inhibited, right? Then after malady, there is another tablet that is known as Saheli. This Saheli has got again synthetic and synthetic progesterones and estrogens in them in it. This Saheli is to be taken weekly. It is not taken daily, but it is taken weekly. It works in the same way as the malady. It also inhibits the secretion of follicle stimulating hormone and luteinizing hormone. So preventing the formation and release of ovum. So acting as a contraceptive device. Then we have got mini pills, mini pills, which are also known as progestin only pills. Progestin only pills, right? They also act as contraceptive device, but they do not have synthetic estrogens in them. These progestins, they again inhibit the secretion of follicle stimulating hormone and luteinizing hormone. So thereby preventing the formation and release of ovum. So it is up to a female which one of these oral contraceptives she likes to use. Mostly used oral contraceptives malady and Saheli, right? In India. Then we have got after malady and Saheli, we have got emergency oral contraceptive tablets. Emergency oral contraceptive pills. For example, we have got I pill, which is commonly available, which is readily available in the market, and we have got unwanted 72, right? These two tablets, they are known as emergency oral contraceptive pills. This I pill, it contains levonorgestrel, both I pill and unwanted 72. They both contain levonorgestrel. right? So they prevent conception up to 72 hours of unprotected sexual intercourse or a failed contraceptive device. Suppose a female was using a contraceptive device. The female was using a femidome or male was using a condom. Suddenly, condom bursts open or a femidome bursts open. Semen is deposited inside the vagina of the female. Then there is apprehension of getting pregnant. So then a female should immediately use an IPL or unwanted 72. So they contain levonorgestrel, and this levonorgestrel, it will prevent the conception up to 72 hours after failed contraceptive or after an unprotected sexual intercourse, right? So it is only to be taken when a contraceptive device fails or there is unprotected sexual intercourse. It is not to be taken regularly, right? So it is only taken in case of an emergency. That is why we call it as an emergency oral contraceptive tablets. And this IPL and unwanted 72. It is readily available in the market and it is having levonorgestrel in it, right? So that was about the oral contraceptive tablets. Now, after that, we have got hormonal implants. Now we have got some hormonal implants. So these hormonal implants, they are the implants which are having hormones in them. For example, we have got Norplant or we have got Implanon. This Norplant, it consists of six match-stick sized capsules. Each capsule has got 36 milligram levonorgestrel in it. So these implants, these six matchstick sized capsules, they are inserted. They are inserted beneath the skin in upper arm. In upper arm through a minute cut. Through a minute cut. So these six matchstick sized capsules, they are implanted in the upper arm. They are implanted in the upper arm through a minute cut. So 1, 2, 3, 4, 5, 6. They are inserted through a cut, minute cut. And this cut doesn't even require a stitch. So a cut is made, an incision is made in the skin, and through this incision, one capsule, another capsule, six capsules are inserted and they are arranged in a fan-shaped manner. And these capsules then slowly release levonorgestrel, which keeps down, which inhibits the secretion of follicle-stimulating hormone and luteinizing hormone, so preventing the formation and release of ovum, right? This Norplant, it provides it provides contraception for 5 years. It can serve as a contraceptive for a regular period of 5 years. Similarly, there is Implanon. This is another hormonal implant. It is a single. Implanon is a single capsule. It's a single capsule, right? It releases a chemical known as 3-keto-desogestrel. It again has got a synthetic hormone, 3-keto-desogestrel, and it provides contraception for 3 years. It provides contraception for 3 years, right? So if a female uses Norplant, she will get contraception for 5 years. If a female uses Implanon, she will get contraception for 3 years. In Norplant, six match-sized capsules are implanted just beneath the skin in the upper arm through a minute cut. They release levonorgestrel, which prevents formation and release of the ovum. Similarly, in case of Implanon, a single matchstick-sized capsule is inserted beneath the skin. It releases 3-ketodesogestrel, which prevents formation and release of the ovum up to 3 years. So it provides contraception for 3 years, and this Norplant provides contraception for 5 years. So they can be efficiently used as contraceptives, and these contraceptives are known as hormonal implants, right? Then we have got another contraceptive method that is known as injectable contraceptives. There are some injectable contraceptives. These injectable contraceptives, they include DMPA, depo-medroxyprogesterone acetate. 150 milligram injection provides contraception for 3 months, and 300 milligram injection provides contraception for 6 months. So DMP injection having depo-medroxyprogesterone acetate in it provides contraception for 3 or 6 months depending upon the dose. If we take a dose of 150 milligram, then it will provide contraception for 3 months. And if a dose of 300 milligram is taken, it will provide contraception for 6 months. Then there is another injectable form that is known as NETEN, norethistron. Norethistron enanthate. It comes in a dosage of 200 milligrams. This is a 200 milligram injection, and it provides contraception for 2 months. Similarly, there is another injectable form that is known as misigayna, or there is another that is known as cyclophem. There is another injection that is known as cyclophem. Both of them contain DMPA and norethistron enanthate, 25 milligrams and 50 milligrams. They provide contraception for 1 month. So they are monthly injections. A female may like to go for misigayna and cyclophem. If a female takes misigayna or cyclophem injection, which contains GMPA 25 milligram and norethistron enanthate 50 milligram, it provides contraception for 1 month. So injectable contraceptives, they include injection DMPA, they include injection norethistron enanthate. DMPA can provide contraception for 3 months or 6 months depending upon the dosage. Norethistron enanthate can provide contraception for 2 months. Misigayna and cyclophem, they provide contraception for 1 month, right? So these are some effective injectable contraceptives, and they all fall in physiological method. So as I told you, physiological methods of contraception or those methods which involve the change in body physiology. So they prevent the formation and release of the ovum, right? So they involve oral contraceptive tablets, emergency contraceptive pills. They involved hormonal implants. They involved injections. So these are all the physiological methods of contraception. I think this is section for today. Thank you.